Good afternoon, everyone. This is Teresa Martin reporting to you live from Anchin-Benderson on day 139 of our public health emergency. For those of you who didn't know, my dream was to be Katie Couric. So thank you for allowing me to live in the moment as a news anchor here. But all seriousness, joking put aside, seriously, what I want to do first and foremost is thank you all for all the support, everything that you have done since we started this COVID public health emergency back in March. I never dreamed early March when we first started talking about this that 139 days later we'd still be dealing with it, that we'd still be managing COVID, and that it would have taken all the twists and turns it has along the ways. Certainly the way we managed it in March is not the way that we're managing it now in August going forward to September, October, November. We are constantly evolving as all of our regulatory guidance changes. We're working closely with ACA, with CDC, the Department of Health, our senior management and leaders to stay current with these changes. What I wanted to share with you now, as you know from recent emails and memos that have gone out, we do have 4 positive residents in our memory care unit. 2 of those at this time are quarantining in place with private duty aides taking care of the majority of their daily skill and needs, and then being supplemented with our nursing staff for med management. We will continue to monitor those situations. Those residents are doing well, and we hope that they continue to improve. 2 of the residents in the hospital are also managing well, and we anticipate that they will return to our memory care unit at the end of their 10-day quarantine there. Best case scenario from everything I've learned today with the Department of Health, if we have no additional positive cases, so that means no staff test positive, and we're still awaiting staff results, no more residents test positive, we would need to go 14 days from today's date, so September 4th, with no new cases, and then complete another 14-day incubation period, which takes us to September 18th, to be considered COVID-free on the unit. If any residents or staff test positive during that quarantine period, then those dates will be extended. And we will work with you on an individual basis, as we have been, sharing news, continuing to try and be transparent so that we all know our current situation. Again, thank you to the staff. When we first started this, and even when we hung the banners here on campus that had said we had heroes working here, I don't think I fully understood what our healthcare heroes were or who they were. So many cases where I've seen a housekeeper just yesterday volunteer to work 7 days a week so that we have dedicated housekeeping in our memory care. Staff that's dedicated to that unit. We've worked really hard with all the managers over the last 24 hours to put together a COVID dedicated team for our memory care unit and to reward them with hero pay, which truly is being earned. So again, thank you to everyone for working with us on that. The staff that is dedicated to that unit should remain on that unit and help us isolate this virus by not using common areas such as our break room on the 2nd floor or the public restrooms on our 1st floor. So as much as possible, we want the dedicated staff that's assigned to that area and to memory care to stay on the unit and work together to help us contain this. At the end of the quarantine period, so say someone tested positive August 13th is the day we got the results, so we're going by the test date. They would quarantine 10 days to August 23rd, and they will come out of quarantine August 24th. They will not be retested at the end of their quarantine period. So this is in accordance with all the CDC, new guidance, and Department of Health guidance. As long as residents' conditions have improved and the quarantine period is exhausted, they will return to our community in the memory care without additional testing, without a need for further quarantine. Residents will continue to be monitored by our nursing staff and caregivers daily for signs and symptoms of COVID. So it's very important, nurses, if you see any signs or symptoms of COVID, that you're letting Amy Jackson, Dustin Schuler, and your managers know about that. Each resident's case will be evaluated individually on a case-by-case basis. Our goal is to determine a safe treatment plan in accordance with all the regulatory guidance that we have. So it's a decision that's made by the senior management of the building, physicians, and families to determine a safe plan. And again, it's done in an abundance of caution with all the guidance and regulatory standards that we have to follow. Staff will be retested again September 1st. Staff should continue to self-monitor, screening when they come in, temperature checks, reporting to the supervisor immediately any COVID symptoms. I think one of the reasons we've done as well as we have at Aviva, and we were successful in keeping it out as long as we did, is because of our great employee participation with employee health policies. So please continue to monitor yourself. Let us know immediately if you have any symptoms or concerns. Should a staff member become symptomatic during this quarantine period, then they can be retested, and we'll have to quarantine for the required time frame. So please, communication is key. Let us know if you have questions, and we will work with you on an individual basis. All of this regulation and guidance is constantly changing, but everything that I'm saying to you today, everything that we're putting into place is being done, as I said earlier, with the latest guidance from the CDC and the support of our local county Department of Health. I currently have our epidemiologist's cell phone number, so that's how closely we are working together. Once we complete the 28-day incubation period, so if we meet our goal of best case scenario, then it would be September 18th, and we would not be retesting our residents. Residents were just retested again August 11th. We have 3 of those results back that were expedited. We're still waiting for approximately 15 to 18 results. So as soon as we get those, we will share that information with you.